Hi, this is Harshada from Prakriti Sports Science and Physiotherapy Clinic, and today I'm going to talk to you about pain, which is one of the most important reasons that anybody would visit a physiotherapist for. Pain is common, but it is also confusing. People don't know how to react to pain. At the first hint of pain, should you panic? Or will that make you just a hypochondriac? Should you work through pain? Will that make it easier and better? Or will that just make it worse? Pain is complicated, it is also individual. It has no objective measure, it is only subjective. And what I mean is that there is no instrument that will measure the level of your pain, like a thermometer would measure temperature. The other thing about pain is that where you feel the pain might not be the site at which it originates from. Complicated, right? None of us can explain pain completely, and I'm certainly not going to try. What I'm going to do instead is give you a few suggestions on how you should react to different types of pain. And today I'm going to specifically talk about activity related or exercise related pain. Before we continue with this talk, you need to understand how we quantify your subjective pain. So we give you a number from 0 to 10. 0 being no pain at all and 10 being absolutely unbearable, terrible pain. And then you get to choose a number between 0 and 10. So you can have a pain which is really mild, which is 1 or 2, or moderate level, which is 5 or 6, or a severe level, which is 7, 8, 9 or 10. Please understand that if you have pain that is already 5 or 6 on 10 or more, then do not listen to the rest of the talk. Please go and get it checked out. Also, if you have any kind of pain in your chest or upper back or upper abdomen, going down your left arm, associated with breathlessness, a feeling of anxiety, sweating, or any of these symptoms, then please do not exercise. Go and meet a physician immediately. Usually, if you have some lethargy, stiffness, tightness, or discomfort in your body, which is mild before exercise, it will disappear about 4 to 5 minutes into exercise. That is because your body has got warmed up and supple, and there are some feel-good hormones which are released immediately into the body when you begin exercise, which make you feel good. So if you have a discomfort of say level 2 or 3 before exercise and within 4 to 5 minutes it disappears, this is okay, you can continue with your exercise. But if instead the discomfort and pain actually increases, then there is something wrong and your body is trying to tell you something. Please listen to your body and stop that exercise. You should also learn to identify what is a joint and what is a muscle if you want to react correctly to pain. So this is a joint, this is muscle. So this is your shoulder joint, this is biceps, triceps, there's deltoid here. This here again is your elbow joint. All of you must have experienced a kind of burning pain in your upper thigh if you are climbing and if you've climbed 30 or 40 steps without giving it a break. But once you reach your destination, within a few seconds, this pain will subside. Similarly, in exercise, you might feel a severe pain or a burning sensation in a muscle that you are exercising, and if you've done a hard set, you might feel that that pain is 8 or 9 on 10 and you cannot do even one repetition more. You have to put the weight down. But within a few seconds or maximum 1 minute, this pain will disappear, you will feel strong again and you can repeat that set again. This is good pain. You should feel this kind of pain if you are exercising well. But if you are instead feeling a pain in the joint, and even if it is not 8 or 9 on 10, but it's just 4 or 5 on 10, this is not good pain. You should not feel any pain in your joints during or after exercise. Please stop and get it checked out. No pain, no gain theory does not apply to joint pain. One of the most common pains which people ignore when they get it through exercise and they think that this also is part of that no pain, no gain and it is good exercise pain is knee pain. Usually they react to it only too late and they come and see us very late. So please do not ignore joint pain. Stop, and come see a doctor. If you always experience a very specific pain in a very specific area, joint or muscle, every time you exercise or after, and then it actually troubles you and interferes with your daily activities, your work, or your leisure time with your family, but it usually doesn't happen, or if it disappears completely, if you take a long break from your exercise or go on a vacation, then please understand that there's something wrong with the exercise that you have chosen. You need to change it. Exercise should never interfere or cause you a pain in your daily activities. It should actually increase the vigor and energy that you have for your daily life or your leisure activities. If it is the opposite, then there is something wrong and you need to get it checked out. Also, let me say that pain is actually good. If you can feel pain, that is good for you. It means that you are alive and that your body is able to communicate with you. Just make sure that you are listening really well. And also remember that all this advice that I'm giving you is only general, it is not specific. I do not know your injuries or your current health status. Please go and meet a physiotherapist or a doctor personally so that they can devise programs that are safe and effective for you. If you are not already following us on all our social media platforms, make sure to follow us so that you will be updated with all the new videos that I plan to post here. Bye and stay well.